Okay, I think we're going to get started. Good afternoon and welcome to the Center for Critical Korean Studies at the University of California, Irvine. My name is Joseph Jun and I'm the director of CCKS. Because of the current COVID-19 pandemic, CCKS, like many other organizations, has had to cancel a good deal of programming. So it is very good to see so many of you here today. By my count right now, I see 107 participants. We missed you very much. My colleagues and I are working very hard to adjust to our new normal, so you can expect from us more programming next academic year that allows us to reach out to the community while doing our part to keep everyone safe. Our event today is a first solid step in this endeavor, so I hope you will join us in the not too distant future as we adapt to our changing conditions. I'd like to acknowledge Professor Kyung-Yeon Kim, who organized this event, and our administrator, Joo-Hoon Shin, who worked so very hard to bring you this event in its current form. For those of you who are joining us for the first time, please allow me just to tell you a little bit about CCKS. In just our fourth year, we are a relatively new center, but we have already established ourselves as the focal point for Korean studies here at UCI and for connecting the university to the larger community in Orange County and the greater Los Angeles area. Now, I could speak for a long time about what our center does, our top-notch faculty, our excellent degree programs, and our commitment to serving our community. But let me boil it down for you to one central function. We are here to protect Korean studies in the United States and to ensure that it flourishes for many years to come. Every year, there is a meeting of Korean Center directors from all over the country. This year, it was online, of course, and it took place just 2 weeks ago. I came away with two impressions from this meeting. First of all, that Korean studies in the United States is indeed in danger. So many directors at this meeting, even those at top institutions, were frustrated by the lack of funding and institutional support. For many of these colleges and universities, Korean studies was simply not a priority, and the current pandemic has only made things worse. Secondly, that UCI was uniquely positioned to address this problem by fulfilling our goal of becoming the leading Korean Studies center in the United States. Like many institutions, including those thought to have far more prestige, UCI has invested heavily in Korean studies over the years. Dean Miller's presence at this very event, I think, speaks volumes for the commitment of the university to Korean studies. And CCKS is filled with people dedicated to achieving our aspirations. So let me conclude my brief remarks with this plea. If you care about Korean studies and think that it deserves a place in US higher education, then please consider supporting CCKS at UCI. In the next year, we need to come up with a 50% match to receive the second half of our grant funding for the Academy of Korean Studies, our primary funding institution. This means we need to raise $500,000 in order to unlock the $1 million of AKS funding. While the current COVID-19 crisis has made our task more difficult, it has become even more important than ever. As we all know, crises are times when centers like ours might become less of a priority, and we are determined to make sure that CCKS remains on firm ground. Right now, we are setting up a series of meet and greets over the next few months, including over the summer, designed to introduce prospective donors to our center, our goals, and our mission. Rakib Haq in our development office is coordinating these efforts, and you can contact him at the number or email address on the screen. Feel free to contact me directly as well. You can also donate to our donate on our CCKS web page, which is also listed there in the image. And as always, CCKS is grateful for your support. We literally would not exist without you. And now without further ado, I'm delighted to turn over the proceedings to the Dean of the School of Humanities, Tyrus Miller. Tyrus has been kind enough to moderate our session today, and he will introduce our speakers.
Thank you, Professor Jun. And I want to say I'm so pleased to be moderating this event of the Center for Critical Korean Studies at the UC Irvine School of Humanities. I can see that there's been just a fantastic turnout, which really speaks to the both the topical importance of this, but also the real interest that our audiences have in Korea's response to the COVID-19 pandemic and the lessons that we can learn from Korea in this present, very difficult, challenging situation. The CCKS does remarkable academic and public programming in a number of areas of Korean studies, but really, especially strong, I believe, in the contemporary area of popular culture and other cultural areas, media, literature, recent history, and also current events like this event. And I'm just very pleased to be able to be the dean of the school that houses the Center for Critical Korean Studies. I really want to see the center flourish and continue to be able to do this kind of important event in a long future. And I'm, again, pleased to see just how much interest and excitement there is about this event. If we were holding this in a live space, this audience would have filled our largest space. So it's really a tribute to the importance of this topic. So I'll be introducing our three guests, and the basic procedure that we're going to follow is we'll have about 5 to 10 minutes of remarks from each of the speakers after the introduction, and then we'll be opening it up for questions from our audience. We'll be receiving those on the question and answer platform, and then I'll be reading them and posing those questions to our panel. So let me begin with introducing In-sang Hwang, the Deputy Consul General of the Republic of Korea in Los Angeles. He's held this position at the Korean Consulate General since August 2017. And prior to his current post, he served as a counselor at the Korean Mission to the European Union in Brussels and as senior counsel at the Korean Consulate General in Shanghai. Deputy Consul General Hwang first joined the Ministry of Foreign Affairs in 1995 and subsequently served as the Deputy Director of the North American and European Union Trade Division and Director of FTA Policy Planning Division at the Ministry of Foreign Affairs and Trade. He graduated from Seoul National University in 1993, went on to graduate study at the Graduate School of International Relations and Pacific Studies, south of us at the University of California in San Diego, and earned a law master's degree from the Graduate School of Legal Studies at Korea University. Focusing on economic affairs, Deputy Consul Hwang has participated in negotiating integral trade agreements, including the Chorus FTA, Korea-EU FTA, and Korea-China FTA over the course of his distinguished diplomatic career. Second, Helen Cha Roberts, President of Seegene Technology. She's the President of Seegene Technologies, the US subsidiary of Seegene Incorporated, the global leader in COVID-19 molecular testing, having provided over 10 million tests to over 60 countries worldwide to date. Seegene's Allplex 2009 in COV test is responsible for the vast majority of the testing performed in many countries around the world, including South Korea, Germany, France, Spain, and Italy. And we know how important that's been to the amelioration of the public health situation in those countries. Dr. Roberts received an undergraduate degree in molecular and cell biology genetics from UC Berkeley, another of our UC brethren up north, and a PhD in vertebrate molecular genetics from Stanford University School of Medicine. Very strong California connection here. And last but not least, Sunmin Lee, professor in the Department of Epidemiology at our University of California, Irvine. Dr. Sunmin Lee is professor in the Department of Epidemiology. She's also co-leader of the Cancer Control Program in the Chow Family Comprehensive Cancer Center at UCI. Before joining the UC Irvine in March 2020, she had been a professor at the University of Maryland for 14 years. Dr. Lee is a social epidemiologist with a main research interest in reducing health disparities among racial ethnic minority populations, especially among Asian Americans. Dr. Lee has conducted epidemiologic study concerning the effects of acculturation on immigrant health and has led or participated in multiple NIH and CDC-funded studies to increase the screening for colorectal cancer, hepatitis B, and also for vaccination, and to improve breast care survivorship among Asian Americans. Dr. Lee received her doctoral degree from the Harvard School of Public Health and her master and bachelor's degree from the Seoul National University. So welcome to all three of our guests. And I'd like to start with you, Deputy Counsel General Hwang, for your opening remarks.
Thank you very much. Thank you for having me, actually. The Korean government is now really, struggling actually to fight this pandemic situation. So taking this opportunity, I'd like to thank you for giving me this wonderful chance actually to share Korea's response with you. And let me start with a brief update of COVID-19 situation in Korea. So since the first outbreak in Korea on January 19th, the Korean government has struggled to contain this virus. It conducted about more than 700,000 tests so far with the capacity of 20,000 tests per day. And as of today, the total number of COVID-19 cases in Korea stands at 11,078 cases with 263 deaths. So the fatality rate is about 2.4%. So as you know, that Korea was the site of a community spread at early stage. And we became the focus of the global attention when we were having more than 900 daily cases at the end of February. But thanks to our aggressive efforts with robust testing and rigorous contact tracing and intensive treating, so our newly confirmed cases have been slowing down, and nowadays around 15 daily new cases. And but as you may know, the recent group infections in Itaewon, the famous nightlife district in Seoul, shows that mass infections can occur anytime until we find vaccines or cures. So we should remain vigilant and disciplined to be better prepared for such an evolving situation. So before I explain the government and response to COVID-19, I'd like to mention each country is faced with its own political and social economic challenges. And Korea is a vibrant democracy, and its economy is heavily dependent on international trade. And also it has one of the most advanced ICT infrastructures. So also I'd like to mention the Korean people's, the civic awareness. All these kind of factors actually allow the Korean government to adopt a more preemptive, innovative approach while respecting democratic values. So Korea's COVID-19 control strategy can be summarized into three main actions, namely 3 T's: test, trace, and treat. So COVID-19 infection can be asymptomatic and it spreads quickly. So we focus on early detection through massive testing and rigorous contact tracing and quarantine, which is followed by intensive treatment at earliest possible stage. So when it comes to testing, we set up more than 635 separate and isolated screening centers, which is to protect healthcare institutions from contamination. And we also introduced drive-through testing stations, which are quite well recognized around the world. And also, we also introduced the phone booth type walking through testing stations. And tracing, the contact tracing is a key element to break the transmission chains to prevent virus spread in the community. The government is really, vigorously tracking down and testing those who have been in contact with confirmed cases. We utilize credit card history, CCTV footage, and mobile phone GPS data when necessary within the scope of our domestic role. And in this regard, I know that many people have interest in this contact tracing issue, so I prepared a video clip. So Jihoon, could you show us the video? Can you hear?
Let me just apologize and say that it seems like we're having trouble with the sound, so I just ask you to follow along with the.
확진자가 어디서
Oh,
발생했는지
there we go.
이번을 찾거든요.
유틸리티만 필요한 거잖아요. 지금 세계적인 그 코로나를 방지하기 위해서 나라에서 필요하기 때문에 하는 것이지 평소에는 그렇게 안 하잖아요.
This aggressive test, trace and isolate approach has kept South Koreans out of lockdown. It's also meant this country hasn't just flattened the curve, it's crushed it.
Yes, thank you. Actually, it clearly shows that how the Korean government is doing in terms of contact tracing. So every effort is to make to protect the personal information. So which means that access to this information is quite limited, only to the KCDC and the local investigators. And all collected personal information will be destroyed as soon as this pandemic situation ends. And only relevant and anonymous information is disclosed to the public. So the public doesn't know the names, addresses of this patient and the contacts. So this purpose is to alert others that may have come into contact with the confirmed patient. And the last one is treating. So at the beginning of this outbreak, actually unconfirmed patients were placed into designated hospitals to prevent community spread. But we learned later that even the most robust healthcare system would quickly run out of the capacity. So we prioritized medical resources. So the patients are classified into 4 categories. So namely mild, moderate, severe, and extremely severe. So a patient with mild symptoms and need little medical care are accommodated in temporary quarantine facilities. This is not hospital. And using government facilities or private training facilities. And they get monitored by the healthcare step at least twice a day for symptoms. And also other patients in the moderate, severe, and extremely severe groups are immediately placed in a designated hospital based on the category. And in addition, this what you call 3T measures by the government, I think another important factor in the fight against coronavirus is the citizens, the people. The high level of civic, this awareness and the voluntary cooperation was most important weapon, I think, in preventing this spread. And Korea, unlike other countries, never implemented a blanket travel ban or large-scale lockdowns or quarantine of the general population, except for shutting down schools or sports entertainment facilities with mass gathering. Instead, the government has made a strong nationwide social distancing campaign. And in addition, it also made a conscious effort to create a sense of trust among the public by being transparent and open in its response. And it has been successful so far. So I'd like to mention that the public trust in preemptive and swift government measures, which are transparent, and civic participation in social distancing have effectively flattened the curve of the COVID-19. So in conclusion, so as I said, despite some encouraging trend of COVID-19 outbreaks, Korean government continues to be on high alert for many regions, and we are trying to be better prepared for such an evolving situation. And lastly, I'd like to touch upon just one issue of necessity of international cooperation, because the COVID-19 issue is not just an issue that will not be resolved with a single country's complete prevention measures. Rather, it requires worldwide cooperation. I stop here. Thank you very much.
Thank you. And now we'll go to Dr. Roberts for your opening remarks.
Thank you so much for the invitation amongst this very distinguished panel here. So I'm Helen Roberts from Seijin Technologies. So we are a wholly owned subsidiary of Seijin Inc. in South Korea. We're a public company. We were established in 2000, and we have focused for almost the last 20 years solely on molecular diagnostic manufacturing. So that's all we do. And a few years back, our CEO had the foresight in 1990 to acquire Seijin Medical Foundation, which is now the largest testing lab in South Korea. So in 1990, that was established. And we have over 700 people, including almost 40 physicians working there. And what's really nice is that Seijin Medical Foundation has set up a really nice infrastructure throughout the entire country of South Korea, such that any lab, any clinic, any local doctor's office can get samples to one of our labs either in Seoul or in Busan, which is the southern part of South Korea, within a few hours to our facility, and test results got returned within 24 hours. And so that infrastructure already existed in South Korea to allow this massive testing that came about during the pandemic. So when the pandemic hit, we were able to ramp up to 15,000 tests per day at our facility alone. And Korea further had over 100 facilities that could provide testing locally in different parts of the country. So that infrastructure, together with quick response from the Korean CDC and the Korean FDA that approved our tests in record time. And not only did they approve our tests and a few others, but they also performed the tests themselves, which is unprecedented. Our CEO again had the foresight in early January to develop this test using our artificial intelligence assay design system. And within 2 weeks, we were able to actually produce the assay. Again, just a lot of infrastructure went into designing our artificial intelligence platform, and that really came through for us. And then the Korean government stepped up to expedite the testing of our tests and approve the tests based on a lot of the tests that they performed themselves in close collaboration with Seijin Medical Foundation. So I think that really speaks to the government and how they quickly reacted. And South Korea has had experience with MERS in the past in 2015, and I think they've learned a lot from that. And they've had regular meetings and infrastructure discussions on how to respond to pandemic. And I think that has really established South Korea as one of the premier testing and infrastructure existing in this pandemic So CGN's contribution, along with about over 70%, almost 80% of the testing in South Korea, as mentioned earlier, we've performed over 70% of the testing in Italy, Spain, France, and Germany. We're also in lots of other countries like Israel, and Brazil is now obviously facing a lot of hurdles themselves. Within the US, we have partnered with quite a few different public and private entities. We announced a partnership with the city and county of Los Angeles, and that's been a very nice work together with them. We've also been working closely with Hyundai and their reach through their children's hospitals around the country in such hard-hit places as in New Orleans and Detroit, and places like that. We've also partnered with major testing reference labs like BioReference Lab, which is the third largest testing reference lab after LabCorp and Quest, and they're conducting tests for many, many places such as Miami, Detroit, and city and state of New York. So along with the private entities, a lot of the public entities that we're working with different states and city groups as well as private groups. Now we have been engaging quite a bit with companies that are trying to get back to work now that the states are opening up. And one of our partners recently tested meat processing plant, all 1,800 employees over 2 days, and found 7 asymptomatic carriers, which was very, very important information for that plant to have under such a short period of 2 days. This lab was able to turn that test result around very quickly and worked 24/7 to get that result back to the customers. So we're hoping that with this kind of infrastructure and capability and our ability to produce over 5 million tests for the US alone this month, we're hoping to help address the testing shortages that we see all around the country. So I will turn that back over to you, Tyrus.
Thank you, Dr. Roberts. Dr. Lee, would you like to make your introductory remarks?
Sure, thank you. I appreciate the opportunity to be part of this panel, and thank you for inviting me for Center for Critical Korean Studies. And I'm going to share my screen because I have some slides to show you. So some of the information that I have is already covered by Council Hwang. So I'm going to focus on what has not been covered. And in doing that, I have some comparisons of what Korea has been doing and also what US has been doing so far to fight with the COVID-19. So I'm going to, this is a graph that I'm just showing between two countries, Korea and US. Interestingly, both countries had the first case on the same day, which is January 20. And Council Hwang went over some of the statistics in Korea. And here at the bottom, I have some data for US. And basically the graph here shows how the cases has peaked in Korea versus US. And if you look at the Korea, which is at the upper level, you see that many of them peaked in late February to early March. And the yellow part is the case that is related to one very big transmitter who was related to the religious gathering there. And so we see that it has been coming down quite rapidly, and then the cases have been reduced. Whereas in the US, the cases started to increase in mid-March, and then it's continued to be pretty high. If you look at the data here, I think US is now doing much better in terms of the testing, but confirmed case and death compared to US is still much higher. So I'm going to compare Korea and United States. So Korean government adopted a massive multi-pronged approach from the beginning and intervened very fast. And it established disease response team on January 3rd, as soon as the new case was reported from China, December 31st, before the first case happened. And this was, as Dr. Roberts mentioned, due to probably the experience from MERS in 2015. Whereas US government response was a little bit delayed, and CDC issued warnings on January 6th, and then screened passengers from Wuhan, and then started US coronavirus task force team January 29, but it was a week after the first case was discovered. And President Trump blocked the travel from China. And also Korea did very early, aggressive and widespread testing. I don't want to mention detail because the previous two speakers already mentioned. Compared to that, I think US was a little bit delayed in terms of screening, and then the screening was also limited to people at the early stage, only those who had very severe symptoms. So not everybody who had some symptoms were able to be screened. Whereas in Korea, even if people don't have symptoms, if they were known to be linked with certain major clusters, they were able to get tested. Korea did extensive contact tracing, isolation, and surveillance, whereas US had limited contact tracing. And also Korea had a high degree of public cooperation and keeping citizens fully informed. And so that kind of public trust resulted in a very high level of civic awareness and voluntary cooperation. In terms of the mask use, in Korea, nearly everybody used masks pretty early on, whereas in the US, there was a limited and delayed wearing of masks. And earlier in January and February, government initially announced that mask wearing is not really necessary unless you work at healthcare settings. So that kind of delayed wearing masks. And also in Korea, cost of testing and treatment are covered by government, and Korea has a universal health insurance, whereas in the US, testing and treatment are mostly covered if you're insured. However, if you're not insured, probably those are not covered, and 27 million people in the US are not insured. And in Korea, restaurants and retail stores never closed, and they admitted customers after checking temperatures. Whereas most states in the US had a stay-at-home order, now that it's easing social distancing, but quite 2 months in the past, the businesses were closed. So these were main differences. And in Korea, as you see in the picture, that's the restaurant with the screeners in between people, and people are social distancing in terms of sitting at the table. And on the right-hand side is the school where the students are all required to check their temperature before going into classroom. So Council Hwang already mentioned this 3T, and test also, this is a drive-through and then walk-through. And in terms of contact tracing, I think also Council Hwang mentioned pretty much in detail, because I was asked by the organizers to cover this. I added a little bit, but I think these are pretty much repeat of what Dr. Hwang already mentioned. So I'm not going to mention in detail, but contact tracing begins with the investigation from the epidemiologic investigators, and they do interview. And if there's supplementary information needed, then they get the data from medical records, cellular GPS data, credit card information, and CCTV footages. And then if the contacts are identified, then they have to do the self-quarantine 14 days. And also once the informations are received from the interviews, then these are shared with other public, as you've seen in the video that Council Hwang shared. And also there is, once the quarantine is starting and then the case is registered, there is one-on-one assigned government staff who monitors the close contact of this person's symptoms twice a day. And those in the self-quarantine will be alerted by mobile phone if their self-quarantine orders are broken. It is known that if the self-quarantine orders are broken, then person is supposed to be paid fine up to $10,000 or imprisonment up to a year. And also people who are coming in from abroad, they are supposed to be checked at airport. They should all report their health conditions upon entry using the self-diagnosed mobile app, and their contact information is also collected. And they should all self-quarantine for 14 days. Okay, and the self-quarantine, people who have quarantined in Korea can be compensated for paid vacation, and also their cost for testing and treatment are covered. And also if any businesses have damages caused by people who are infected, stops by or stays at their business, in that case they're compensated. And these are some of the food and other items that people who are self-quarantined at home are receiving as a delivery from the local government. So while they're at home, they have at least some foods. And privacy issues, many people are interested in how Korea did this. And the government, this is information I got from the KCDC, and what they are saying is that it's not collected for everybody, but only if the interview doesn't give clear enough information, then this is collected. And information that collected will be destroyed. Okay, and this is all the law and Infectious Disease Control and Prevention Act that is that the Korea is basing on checking all this private information and using it. So I'm not going to go over all the details, but there are these kind of laws supporting that these head of certain administrative agencies and head of local government, public institutions, medical institutions, pharmacies, corporations and organizations and individuals have to provide following information if they're asked: their names and registration number, which is similar to Social Security number in the US, and their contact information, other medical records, immigration control related information, and movement and path of the patients. Also, this one shows how police can also request this kind of information if needed. I don't want to go in detail. Also, these are other kind of legal grounds that this was revised for the public safety over private individual privacy. I also want to bring attention to wearing masks in Korea and then United States. As we know, wearing masks can greatly prevent transmission of disease, and one can protect oneself from getting the disease. And in Korea, wearing masks have been not really a new thing, because in Korea, people have been wearing masks for a long time to prevent from air pollution coming from the fine dust. So wearing masks for COVID-19 probably had relatively less resistance. However, in the United States, early on, there was a wrong message from government that wearing masks is not really necessary at the community setting. During COVID-19 in Korea, people think that this is a socially accepted act of kindness. This is kind of part of Korean culture, that those who, so that they're supposed to be wearing it to prevent them from giving the disease or transmitting the disease to other people. And so if you do not wear, that's more likely to be stigmatized. Whereas in US, there is some stigma related to wearing masks, and people are sometimes afraid of being thought as a virus spreader if one wears masks. I think it's getting better these days, but still there are some stigma. And Korean government early on urged mass production and managed supply of masks. So this drug utilization system called DUS in Korea shares individuals' prescription and mask purchases record nationwide in all pharmacies. So at the peak time when there was COVID-19 cases were so many exploding in Korea, people were able to buy 2 masks per week from any pharmacy based on this record, and also based on their birth year. In the US, however, masks were not available for a longer time for public, and I think it's becoming more available until recently, but masks were not really available in the early days. Okay, treat, I think Council Hwang already mentioned this, so I'm just gonna mention briefly. I think the allocation of hospital beds were based on the severity of the patient to be more efficiently using the healthcare facility. And these are 4 steps I think Council Hwang already went over, so I'm not going to go over these. So Korea started easing the social distancing starting May 6th. And then very short time after this, we've seen that the cases from nightclub clusters in Seoul, and then so far 187 new cases are identified from this nightclub cluster. And Korean government is now doing contact investigation and infection control. And now there is a new discussion how to collect the contact information when people are, mass amount of people are in one facility like nightclub or sporting facilities or other places. And there is now a discussion of using this QR code that you see here to collect information in a simple way, very fast, using mobile phone. And now Korea, so far schools have been closed, but Korea is now considering opening high school only for the 12th graders starting on May 20th with temperature checking requirement. In Korea, it is very important life event to take the college entrance exam in fall. So I think that is a special consideration for these students who are 12th graders. And also baseball game started its delayed season without fans in the stands. So my thought is here, whether, you know, what have been done in Korea, is this model transferable to US or other countries? And things for us to consider is, can other countries impose onerous measures in the absence of crisis level outbreak? In US's case this time, it was a little bit too late. But in Korea, they were able to respond faster because of the MERS experience in 2015. So maybe US can respond better when it similar thing happens next time. Also, another thing to think about is social trust in other countries as high as in Korea? Or is public safety considered more important over individual privacy, or is it vice versa? I think this also makes difficult contact tracing if people are not buying into public safety over individual privacy. And also wearing masks sometimes have cultural connotations, which also may act as barrier. And healthcare system also makes difference whether everybody is insured versus whether some of them are uninsured. So I think this is it for my remarks, and then I'm going to get out of my slides. Okay, thank you.
All right, I want to thank all of our presenters, and we will now go to questions from our audience. And while you're thinking of those questions and putting them into the question and answer, we can maybe I'll just pose a question to give people a little bit of a chance to think of what they would like to ask. So I'm happy to both hear in the news and from what Dr. Roberts in particular was saying, improvements in the situation with testing here in the United States. But I think we would probably all agree that we're not there at a really fully effective testing and tracing regime by any means. Rather than ask in terms of what went wrong or what have we done wrong, if you had the opportunity to advise a policymaker on, you know, one or two of the most important things that we could still do to help improve the situation, what would be some of your advice to these policymakers? And I'll open that up, whoever would like to start.
Yeah, thank you. I think I think about it, and I think one of the most important things is time. I mean, the rapid response. Actually, as somebody, I mean, the expert said that Korea learned from its past experience, especially in the MERS case in 2015. So at that time, Korea's reaction was very slow and very non-transparent and dismissive, so heavily criticized. So this time, Korean government has been very determined to be prepared for all this kind of situation. I think a second one is trust, as I said. So this, I mean, swift and transparent measures by the government got public trust. So which also enabled the public actually to participate in the social distancing very efficiently, very cooperatively. And in order to do that, actually, we need a transparent communication between the government and the public. So we had daily briefings twice a day, so with English simultaneous interpretation. So I think it has been successful so far.
Okay. Would either of the other panelists like to comment on this?
Yeah, so going forward, I think we all agree that it's a little bit too late in terms of what Korea was able to do, and to replicate that in the US would be very difficult at this stage. However, you know, now there are quite a few tests hitting the market, and its availability seems to be very spotted, to say it. And so I was just talking to my next door neighbor, who's an elderly lady, and she was not able to get testing in San Francisco Bay Area. And, you know, the San Francisco Bay Area is on the news all the time as having one of the best coverage of testing. And so I talked to a doctor's office and they offer the antibody tests from Quest, but no molecular tests because there are no swabs available. So you're hearing that all around the country. And I think what we need to do better is we know we have a lot more tests, but we don't have complete tests in some cases. And we don't understand the difference between a serology test and a molecular test and an antigen test. And the false positive rate, false negative rate. These are very complicated concepts for the general public to understand when there's so much information out there, right? And so whether it's the Trump administration, the governors, the CDC, the FDA, there has to be a much better consolidated information, right? So that it's a little bit easier to understand. The options are in one place and you don't have to go search through 50 websites just to figure out what these tests all mean. When is it good to use the blood test? When is it good to use the swab test? Can I use the saliva test? These are very, very confusing for most Americans. And I think what we need to do now is find a website that's trusted by the Americans. Simplify it, please simplify it. Give resources on where they're going to find that lab that can provide testing and what the costs are, right? We know the reimbursement for molecular tests is $100. Okay, most Americans don't know that, but those of us in the industry know that. Americans should know that, right? And antibody costs should cost about this much. Americans should know that. So they can make a decision. If I want to get tested, I'm willing to pay $50 for an antibody test. I'm willing to pay $100 for a molecular test and have access to it, to a trusted lab. These are the kind of information that's really tough for people to find out if they're not in the industry or they're not connected to the right people. And it shouldn't be like that. And I feel that because of this, there have been a huge flourish of these brokers and people who are not even from our industry brokering this information in piecemeal and causing almost even more confusion. So, it's time for the federal government to work together with the governors and come together and make a centralized information center. And I think CDC and FDA obviously need to take charge of this and make it easy and accessible so people can go to one website, understand the price, and then click and get to the local lab that can provide that testing. That information is just really, really difficult in America.
I can confirm that because I myself don't know that information that you mentioned. Dr. Lee, would you like to offer a recommendation?
Yes, I agree with Council Huang and Dr. Roberts. I think those transparent information sharing and communication very important. I think that will greatly increase the testing and other efforts. One thing that I think I'm lacking in the US is I think sharing information about contact tracing. I don't know how much that could be done in the US, but with especially easing the social distancing now, having that information may make people less anxious about the disease or infection. If they know who's infected versus who's not, which place is safer versus not safer, I think it would be much better for people to go out and do activities and navigate. So I think if we could do better on that, I think that would be great.
Thank you. I hope that we can take this excellent advice. We have some questions that have come in now, and I'll read the first one. What is the progress made so far with vaccine creation? And have you seen this being a cooperative global effort or more of a country-led initiative? So more national competition or more global cooperation in the development of the vaccine?
Well, actually, a few days ago, my president made a speech in the WHO summit. And now everybody is scrambling to find the vaccines and cures for the coronavirus. And our position is very clear, actually. We should make these vaccines or cures public goods, which is available to anybody in the world. So I think we have to join the concert approach to develop these cures and vaccines, and then we should make these vaccines available to everybody.
Yes, and one thing that I feel optimistic about what US is doing, especially is the vaccine. And I think everybody heard about the news yesterday about Moderna company having a result from phase 1 trial about the vaccine, and it proved to be safe. And then it's showing some kind of antibody made after the vaccination. So I'm hoping that the US with other country will have concerted efforts to making vaccine. And it seems like US is doing that very well. So I'm hoping that US probably can be one of the leading country to make this vaccine available for many people in the world.
So we have another question. First of all, they wanted this person wanted to thank all of the panelists, so I'll convey that to you. The question relates to the video that Dr. Wang showed, and it suggests that simply having a person with COVID-19 walk by you briefly would lead to exposure and quarantine. In the US, we consider it an exposure only if a person is within 6 feet for 10 minutes or longer. Could the panelists talk about standards for what's considered exposure that requires quarantine?
Well, if I mention regarding this Itaewon cases, at that time, this guy, the 29-year-old guy, visited Itaewon early May. And what government did is ask all the people who visited Itaewon between April 24th to May 6th. So 2 weeks incubating period to be tested. So I think we want them and include as many as people possible to be safe.
Do either Dr. Robert or Dr. Lee have any other comment on the quarantine protocol?
Don't.
Okay. All right. How is Korea responding to, or how does Korea plan to respond to the appearance of a second wave or the possibility of a second wave of infection?
This is a really very good question and difficult question, actually, since we had this community spread across the Itaewon. So until we find cures or vaccines, we have to be on alert. And what we are doing is we are asking the public to be vigilant and disciplined, and then to keep this social distancing and personal hygiene. And also we are, intensify, our measures, the quick response, this contact tracing and massive testing. So those two are, what we can do right now.
So it's probably, at least for some significant period of time, we're going to have a different relation to our social space and to our interactions in well.
Yeah, and I think it's not clear yet whether people who've been previously exposed are, now immune. Obviously, that's the basis for vaccines. But initial studies from China and South Korea that thought some people were being re-exposed. More recent study in South Korea shows that that's probably not the case. It's most likely that there was some residual dead virus in their nasal or throat that were detected by these very sensitive tests. And so all indications so far are that if you were exposed, you do seem to have immunity. So that's really good for all of us. How long that immunity lasts is a big question, obviously. But at least that gives us some semblance of, the serology tests that are a little bit more readily available can help us understand within our population, our local population, what the infection rate is, what your danger levels are, and if you think you've been exposed, how to get tested. So there's more and more scientific evidence showing that social distancing, wearing masks, these are not going to go away until, all of us have major herd immunity and vaccines in place. But for now, at least it's a good sign that people don't seem to get reinfected.
Good. Okay. How should states plan to reopen given the state of testing and asymptomatic carriers? We've heard of places here that plan to use, for instance, temperature checking and self-assessment, whether on an app or some kind of survey that you fill out every day as you come into work or class, And UCI is in fact included in this category of places that is considering this kind of method. Do you see that as something that will be effective and help? And how does that interface with some of the other measures that you've been talking about?
Well, actually, in the case of Korea, the high school will be reopening. I mean, as of Wednesday. So it been yes, I think already opened. So, but only for the high school seniors. So, but because we cannot close the schools indefinitely because the high school seniors are preparing for college entrance examination in December, which is very important. So we want keep our business, the life going on, but at the same time we need the control this coronavirus. So I think we for the time being we should balance those two things actually to be sustainable.
Yes, and I also think I agree with Council Hwang, and also I think people now should accept that there is a new normal until a vaccine is developed or treatment is developed. And so even if state opens, I think we should still keep that social distancing and be alert about gathering together or opening schools and other things. So mask has to be always worn. And depending on the areas of the state, for example, Maryland, where I'm currently living, depending on the county, we are easing social distancing versus not. So I think the local government has to probably more closely track by region by region, not just by whole statewide, and continue to check the cases and the trend before opening up everything. And then people who are now allowed to go out still has to be very alert.
So it does sound like one of the lessons that I'm taking away is just a kind of patience about this, because we have seen a lot of both popular impatience and, also in the sense of our political leadership wanting, it's like, oh, we've done this already for 6 weeks and we want to be over with this, but it's not going to be over for a while. So we will need that kind of patience. Dr. Lee, there's a question that when you speak of local government in Korea collecting TTT data and providing support to citizens, how would that compare in terms of the level of government in the US? Would that be state level government as the significant comparator, or?
Yes, so when I mentioned the local government, it's either state or city government that they are doing this and closely following, monitoring, and then supporting. So, I don't have a whole lot of detailed information, but local government at the state and city level has been very actively involved, closely working with the central government in Korea, like the federal government in the US. But they have all these very well set up plans on how to support in terms of like food or economically and support business. So I think US can also in the future next time could think about supporting for people who are being quarantined and or not able to work.
We have a question that is asking for a comment on efforts to screen employees before having them return to work. What testing and symptom screening would you recommend? And also, did South Korea implement any particular efforts in this area of employee screening in having them return to workplaces?
Yeah, so definitely I've talked to my collaborators over at Hyundai, and they have an 11-page document that I'm really trying to get a hold of right now because I want to read it. But they worked really hard in South Korea with the Korean ministry, as well as with the CCKS Inc., our headquarter, to come up with a testing regimen and strategy. It includes a lot of mask wearing, staggered start times, and different days of the week where people work from home, even the people who need to come in, making night shifts available, coming into work not every day, staggering the employees, testing randomly and more more acute testing if they suspect anything. We also discussed Friday night testing. You know, you get tested and you stay home. You are responsible, and by Monday you know your status because the testing is done on Saturday. And as long as you're good over the weekend and not at the beach where everybody's not wearing masks, then you're probably safe to come back to work on Monday. So for those people who really need to be in the office, they have a lot of different levels of organization to decide how to test, because testing is expensive, right? And so how to test, who to test, and how to best spread out their workers.
There's a question that relates to a kind of daily life aspect, which I really appreciate. And that is that we can't currently enjoy dining out in California. Have restaurants, eateries, and street food in Korea changed because of the current pandemic situation? Is business down or is it returning? What is the situation with the food industry and the restaurant industry?
Actually, we did not any lockdown for specific facilities except for this sports and entertainment facility. So the restaurants are open. Actually, the expert explained already. But I mean, we are using, as I said, I mean, the transparency, this divider to protect each other. So, but anyway, because of this social distancing, actually, at the beginning, a lot of people don't want to go to, I mean, the restaurant. So the business was quite slow, and then of course they suffered a lot.
But now there's a kind of returning confidence in dining out as safe.
I think so.
Yes, and most of the restaurants are checking temperatures before they accept customers, and then they have this transparent divider where they keep people apart, and also they keep the empty seats in between, so that even if people come to restaurant, they may feel more comfortable. And I am hearing that the business is slow, but it's coming back.
Very good. There's been talk about there being two strains of the virus, one that's more prevalent in Asian countries and one that's more prevalent in Europe. How much concern is there for additional mutations? And also, has Korea identified any mutations of the virus over the past month? And it's obviously one of the backgrounds for that question is just concern about how effective a vaccine might be if this is a virus that is beginning to differentiate and mutate.
I'll probably defer that to Dr. Roberts. I don't think I have that expertise to probably answer.
I apologize. I only heard the second half because our gardeners started up the lawnmower and I said, stop, stop, stop. So could you repeat that question?
Sure. The question is that there's been discussion of there being two strains of the virus, one which is more prevalent in Asian countries and the other in Europe. And also, concern about potential for the virus to mutate, particularly with respect to whether a vaccine can be developed that will be effective, certainly in eradicating it, but even, to kind of keep up with the changes in the virus and be effective for all of the potential variants of it. They were basically asking whether any mutations had been identified in Korea, and then I think more generally just about this issue of the potential for mutations.
Yeah, I think mutations obviously happen throughout. There's a very nice consortium of researchers that UCSF and others are involved in. I think it's nextstrain.org, where they're tracking the mutations around the world. And at last count, I saw there were about 11 different mutations. Keep in mind that when we're developing vaccines, we're targeting small pieces of protein. So most of these mutations are going to be silent in terms of the vaccine creation. So the vaccine makers luckily know what they're doing, and they're targeting certain structures, certain protein structures that are unique to this particular coronavirus. And a lot of these mutations probably are not going to affect that. Some could, but most of them will not affect that protein structure that they're targeting. So that's why the vaccines keep changing, right? So they want to make sure that it's active to the current circulating strains. So the vaccines they're making now will target the current. If it mutates enough, then they would be, making a new one, of course. But for the immediate future vaccines, they're targeting the strains that are circulating now. So within that time frame, we should be okay, most likely.
Thank you. So there's a question about your thoughts on the reopening of the beaches in Southern California. Do you think that people will follow the guidelines for social distance and safety? And also, maybe I'll just add my own kind of footnote to this question. Do you think that the measures that have been introduced are sufficient to keep people safe while enjoying, our beautiful landscape and our beautiful beaches?
I haven't been to the beaches of California yet. I'm still in East Coast, but I'm sure that many people are very much looking forward to enjoying beaches, especially the temperature goes up. I really hope that people will be voluntarily keeping social distancing and following all the measures. However, if the cases happen where people are not really keeping social distancing, maybe we may have to think about some other measures of enforcing some type of things. I hope we don't have to go into that route, but I don't know, maybe fines or some kind of warning, issuing warning if people are not following. I mean, I've watched TV news a week or two ago where it showed California beach, and I saw that people are very much close together. So I am very worried about seeing that kind of pictures on the TV. So we probably have to trust them to do the things, but if they're not following, I don't think we can just let it go in that way, but there must be some other measures developed to enforce that social distancing or other measures needed to be preventing ourselves from the disease.
Actually, in this regard, there was a case, and this is not beach. Beach is an open space, but a confirmed patient visited a church before testing positive. And the authorities actually tracked down and then tested, all 900 people in the church at the time, and all tested negative. But we found that they strictly kept social distancing. They were wearing masks and hand sanitizers. So I think this social distancing and then the personal hygiene is really play important role. So I think if you keep this, I think we could be safe.
Thank you.
Yeah, and I think it seems clear that, obviously outdoors is going to be very helpful. The sun is going to be very helpful. Mm-hmm. But mental health of people and the economy obviously are the critical reasons why we do need to help those who want to get outside a little bit. But for those of us who can afford to wear a mask because we're not jogging, we're just walking around, and these are thin masks that they're asking us to wear. We're not asked to wear N95s, right? So we have to do this for our elderly and our vulnerable. And America's high obesity rate is another reason that we all need to be careful. And I think it's not that much to ask, right? So stay home when you can, get out when you need to, but stay safe when you get out, right?
Yeah. So this is another, just I believe, a comment about the beaches, and this is referenced to Huntington Beach. This audience member said that they were driving by this weekend just for the scenery, and only possibly less than about 1%, about 5 to 10 people that they passed by had masks on, as the small shops were packed. Shoreline itself was filled with people, and even they say that if there were police around, they were there without masks as well. So we obviously have a long way to go in this consciousness about the importance of mask in those sorts of even outdoor situations. I think that this was mentioned by one or more of you about the travel protocols for visitors to Korea. But I would like to just ask you to reiterate what the current protocols are, and also, you know, if you anticipate that changing anytime soon, any significant changes in that. But if you could just reiterate that for this audience member.
Yeah, actually, every arrival from overseas, regardless of their nationality, is required to be under self-quarantine for 2 weeks. And within 3 days in this self-quarantine, they are tested. So everybody. So and then they will be, allowed to, to do emergency activities and whatever. So this is quite clear to us. Then this is to protect people, also protect the community.
Yes, in addition to that, I think I briefly mentioned, but everybody, once they arrive in Korea at the airport, they have to download an app and they have to self-diagnose themselves and answer the questions. They have to fill in the contact information so that government has all the information in case later they test and become positive, that we can do contact tracing. So they're collecting all the information at the airport for everybody who's coming into Korea.
You had a question that was coming in, but it came in incomplete. So I'm gonna, there's one more question in our queue right now. Okay, so wearing masks has been widely politicized in the US, and there's strong resistance among some groups as they see their individual freedoms are violated. And that LA Mayor Garcetti required the wearing of face covering. There's lots of criticism that the mayor can't actually enforce that. Do you have any advice or thoughts about how we could persuade these groups of people and individuals that are resistant to the idea of mask wearing, or thinking about it in the wrong framework, that might be good-hearted people but are misled about the implications of mask wearing?
I think it's very difficult to change the norms right away. It's going to take time. However, I think we should keep educating the importance of wearing masks, and then also people have to feel like that they have to protect others by wearing masks, not only themselves. And people have to know that by you not wearing masks, you're going to be making other people sick. So people have to have that feeling, but then changing the norm is not going to be happening overnight. I think we should continue to educate people and make them aware of it. I know that we once were not really wearing the bike helmet, but then over the time, everybody now is wearing a bike helmet. So it's going to take some time, but we should continue to try, educate, communicate, and let them know about the importance of it.
And one more thing, actually, I already mentioned, actually, if you don't want to be infected, then please wear masks. Just the case of the church, actually, where it's very enclosed, very crowded, but wearing mask and then keeping a little and social distancing, actually, successfully, damped the risk of coronavirus spread.
So there's the more altruistic argument and also the more pragmatic argument about staying well. Dr. Roberts, excuse me.
Yeah, no, and I was also going to say that if you don't want to be shut down again, wear masks, right? I think all of us suffered tremendously during the shutdown, economically and mentally. So, if we don't want to be shut down again, if we want the states to open up and stay open, mask is going to help more than most things, right? So we should wear masks.
So one of our, again, another question on masks, but specific to universities, as students, staff, and faculty return to campus, should mask wearing be mandatory?
I think so. I really hope that will happen, yes. Because we are going to be in a closed space, very close to each other, depending on what kind of lecture room you're thinking about. But students can be pretty close to each other without mask. I can't imagine inviting students back to the campus.
A lot of
I'm sorry. Taris, do you mind if I ask a question here?
What's that?
Do you mind if I interject and ask a quick question?
Please, Joe.
Yes. So this is a question I'm not just on behalf of myself, but we have many faculty here, many researchers who regularly go to Korea in the summers to do research, to participate in the university life there, along with many students who go for classes for language training. Myself, I'm scheduled to teach a graduate class at Yonsei this summer. So it's not just my addiction to my favorite samgyeopsal restaurant. But I guess I'm wondering, what would you say in terms of guidelines for when, you know, what do you think about traveling to Korea for U.S. Residents right now? And if now is not the appropriate time to begin, what sort of signs or changes should we look for when it is safe and advisable to travel to Korea?
Well, nowadays, actually, Korea is becoming safer than ever. And even, I mean, some Korean students here want to go back to Korea to be safe. But, you know, for, I mean, the Korean citizens and Korean, I mean, for US citizens, actually, Korea has no problem to receive them. But the thing is, they should be under self-quarantine for 2 weeks and then get tested. So the 2 weeks time, they should be under self-quarantine. So it creates some problem in terms of business. So our consulate and the overseas Korean consulate and embassies are issuing some self-quarantine exemption certificate. So, I mean, taking this opportunity, I think we can, I mean, visit Korea without any problem.
So we have another question about mask, which is, you know, a very hot topic. The homemade mask the homemade face masks are obviously not effective as, you know, professional healthcare PPE, and they're not as effective as a surgical mask. Do you have any comments on what the norm is in Korea for mask types? And is there any kind of type of mask that's encouraged? And also, do people in Korea have easier access to surgical masks? I know that you mentioned that it was possible to purchase these in pharmacies. Could you say a little bit about the type of mask that people are wearing?
Yeah, I think in Korea, where the history of wearing masks is going back to much before COVID-19. Like I briefly mentioned, people were wearing masks even to cover them from this dust, the fine dust that's very common in Korea in springtime or other times. So mask has been there for a long time, and also there has been very critical quality control for mask and production of mask in Korea for a while. So the masks that are now produced and sold in Korea are pretty high quality that has to go through the testing. I forget the exact name, like F94 or something, that there is like a guideline that they have to pass in order to sell the mask, saying that this is Korea qualified mask or something, so that has a filter, and that's different from the people who make from home as a face covering. So I think almost everybody in Korea is wearing that, and it's readily available in Korea now. I think at the peak time during February and March, there was a shortage of the mask where people had to take turn and go to the pharmacies on certain days based on the number of the years that they were born. And so they take turn and buy only 2 masks in a week. But now that they're readily available and they're very good quality, and then government has control over the quality, and they look very closely to what kind of masks are produced, and the facilities have very high quality production settings. So I think in Korea, people are wearing the masks and producing really good quality masks.
There's one more question, and it's kind of been in the form that it's been posed. It's kind of been very implicit in your answer so far about the way in which until a vaccine is developed, that a number of the different measures of social distancing and various kinds of tracking restriction will need to stay in place. So I want to ask this in a slightly different way, and it has to do with a pronouncement that one expert made recently about the danger of the winter season coming on and the potential for interaction of the COVID situation as a yet unresolved, fully unresolved situation with the normal flu season or other sorts of, other sorts of events that might come back. And, this was a rather dire prediction, but something that was really predicting, the potential for a fairly strong second wave. Do you have any thoughts or comments about that?
Yeah, so I think right now we don't know the severity of the COVID-19. If you throw on top of that any kind of a common cold or influenza or RSV. So for us test makers, we do offer a lot of different tests, including for flu and RSV, and we're making sure that the minimum test requirement for this flu season coming up would be COVID-19 with flu A, flu B, and RSV. That's just going to be a common test for everyone who comes to the clinic with any sort of symptom or any suspected exposure. So that's just going to have to be, and we do expect that there's going to be people who could potentially be multiply infected, who could be severely sick. And so we don't know what it's going to be like, but as far as test makers, we're definitely all preparing for that.
And we have a question that is stating that the South Korean government is publishing the whereabouts of people who have tested positive for the virus. In this person's opinion, this strategy is the secret behind South Korea's success ability to successfully control the spread of the virus. They are wondering how Koreans think and respond to the government's policy. And it sounded actually like maybe you, might have some issues with the way that's
exactly. I mean, in the video clip, actually, the lady exactly said, actually, this is for the public health. So I think the Korean public is willing to compromise the privacy for the sake of the public good, public health, and the freedom of movement. So I think this is a civil awareness. Actually, Germany actually had a meeting with our government officials, and finally they decided to introduce this kind of a contact tracing system. So they are doing some nationwide campaign to convince the public. So I think that this is well accepted. So without, if you don't want to make a kind of a travel ban or close borders, that I think this kind of contact tracing measure is really needed.
Yeah, and I think that I remember hearing about Google and Apple's teaming up to come up with some solutions along these lines, and with all the privacy advocates are that's definitely not my area of expertise, but you see it works, right? So obviously it has to take any kind of identifying information out of there, but it is for public health, and it is to allow us to open up and move around and restart the economy. So, we hope that there can be some kind of public health message that promotes this with a lot of privacy concerns of America in place.
So Professor Jen, I saw that you have another question by text.
I'm getting questions by text message at this point. So this is for Council Huang. I wonder if you can just comment on the overall effect of the pandemic on the Korean economy, and just any comments you have about how the economy is doing.
Of course, I mean, we are suffering. I mean, just like any other government, but any other country. This quarter, the first quarter, the Korean economic growth is minus 1.5%. And this year will be, in general, minus 1.5%. But in the global economic growth rate will be minus 3%. So Korea is in good position, but this is thanks to the good performance in global sales in semiconductors. But these semiconductors are now suffering, and they shrink a lot. So in the second quarter, we expect also a worse result. So this is something we have to come up with, and we have to live with. So I hopefully, when we find this vaccines or cures, then I think our economy will get better, along with the other global economy.
And if I could just follow up on that really quickly, of my own interest, what do you anticipate will be the effect on Korea's trade, since trade is so important to the Korean economy.
Exactly, yes. I mean, as I said, I mean, the Korean economy is heavily dependent on international trade. And because of this, I mean, reduction in global consumption, especially in Europe and the United States, I think our growth rate will be, I mean, the growth will be severely affected by it. And I think without any these cures and solutions, I think this global economy will suffer. And even though they will recover, I think it will not just like a rebounding, just as it just shrink. It's like a Nike brand style. Just it shrink a lot, but rebound very slowly. So I think probably will suffer another 2 years.
Well, we have no further questions from our audience. So I want to, first of all, just thank all of you for your remarkably informative and interesting presentations and answers to all of these very pressing questions. And I want to thank you for your time in being with us here. I really reflect that also from our panelists. So many of our panelists started their questions really with thanking the panel. So Professor Jen, do you want to say any closing remarks?
Yes, just very briefly, I just want to also thank the panelists. This has been fantastic, and all of the very many people, who got quite a robust audience for this. All the people that tuned in in my head, I'm calling it CCKS TV. This is, as our panelists have made clear to us, this is the new normal for us. And so we're hoping to do a lot more programming like this. So if you are interested, please contact us, check out our website, and join us when you can for these events. And we would love to have you. So please keep coming back.
Thanks so much.
Thank you.
Thank you.
Thank you.
For having us.
Thank you, everyone.